Their seats. We're going to go ahead and get started. Testing. Okay. Doing well. How are you? Glad you guys are here. Are we good? All right, let's go ahead and just call the meeting to order. I want to thank friends from the County Commission who are here with us for this joint meeting. I'm going to give the floor to Chairman Dennis, who I believe has their own procedure for starting us off. So, Chairman, the floor is yours.
Thank you very much, Mr. Mayor, and I want to thank the city for hosting this event today. I think it's an important discussion that we're going to have, so I appreciate that. With that, I'd like to call the meeting to order for Sedgwick County Board of County Commissioners for February 24th, 2022. Madam Clerk, next item.
Roll call. Commissioner Meister?
Present.
Commissioner Cruz?
Present.
Commissioner Howell?
Present.
Commissioner Lopez?
Present.
Chairman Dennis?
Present. Next item, please.
New business. Item A, mental health and substance abuse discussion.
Thank you, and I'll turn it back over to the mayor.
Thank you, Mr. Chairman. And to start us off, we'll go ahead and recognize the Honorable Sheriff Jeff Easter.
Thank you today. I appreciate you allowing us to speak to you today. As you know, there was an en banc meeting a while back where this governing body had given some tasks to the Mental Health Substance Abuse Coalition to take a look at. So we're back today to give some updates in reference to what the Mental Health Substance Abuse Coalition has been working on, what our priorities are, and what our strategies are. As you know, our mission is to develop a sustainable, accessible, and integrated system of care that serves people with mental health and substance abuse disorders who are in crisis in order to efficiently and effectively deliver services that create positive outcomes. Our vision is to create a community where people in crisis find a place of hope and a path of health. As we've talked about before, this is what makes up the coalition. What we talk about is it's made up of nonprofits, government, and business leaders within the community. Today, we are going to be reviewing the coalition website. Is the top of the information tab that we have. For anything to do with the coalition, you just have to download or click on the www.mhsacoalition.org, and that's where the en banc report is, which was provided to you before this meeting. You can download it. Anybody in the media can download it from there, and also any citizens. On September 28th of last year, we met to discuss issues facing the community, specifically mental health, substance use disorders, and homelessness. At the end of the meeting, the coalition was tasked. We were tasked with looking at these different issues. First, I want to say that we appreciate the faith and confidence that you have provided us and that you have in us. We are also asked to address a few other issues, including domestic violence, gun violence, and youth violence. While some of the solutions in this plan will help in those areas, they are complex issues and currently have existing efforts ongoing to reduce their effect on our community. They also have unique stakeholders and additional significant issues that impact those areas of concern. We recommend that the council and the commission engage those stakeholders to support their efforts, and we're speaking specifically to domestic violence, gun violence, and youth violence. As you know, the substance abuse and mental health disorders and homelessness are huge issues in itself. Yes, they have some effect on gun violence and DV, but we look at those as separate issues because we're trying to still, for the last 3 years, move through drug issues, mental health issues, and homeless issues. This report was developed by our team from the Public Policy Management Center, so you'll be hearing from Misty Bruckner here soon, Brenda Dietzman, Don Shepler, who is our new Executive Director. And so if you don't mind standing up so everybody can see who you are. This is Don Shepler, who will be taking Brenda Dietzman's place. So thank you, Don. So Robin, I, and Misty will be walking through the mental health substance abuse slides. And also Brenda will discuss their work on the homeless section as well. So with that. One last thing that I'll talk about is the purpose. We are trying to work through a lot of these issues for the last 3 years. Misty has been very integral, her and her team, of meeting with a lot of you in this room to kind of understand what it is that you want and what you would like to see. So with that, Misty, come on up.
Good morning. I'm Misty Bruckner from Wichita State University at the Public Policy and Management Center. Just want to touch upon a couple things we've hit on previously. One is the idea of the cost of the system already. You've seen the high utilizer study before, where we talk in the care that was provided over 4 years to 500 folks cost over $17 million, over $4 million a year in unreimbursed or public assistance. So as we talk today, I know there's a lot of requests and a lot of actions that we're talking about, but there's a huge cost that's happening right now, financial cost and cost to people's lives that are happening there. Also want to just remind you of the cost avoidance study that was done, which talks about getting people into the crisis center to get care and how much more effective that is as far as delivering services to folks and getting them the help that they need. So as we walk through the report, just want to keep those two pieces of information in mind. And also just to talk a little bit about this intersection. We started out as the Mental Health and Substance Abuse Coalition, recognizing that there is an overlap within the homelessness population that does have higher occurrence of mental health and substance abuse than the general population. Our focus has always been primarily on the mental health and substance abuse because people who are experiencing issues with that, not all are homeless, right? And people who are experiencing homelessness, not all have mental health and substance abuse. So there is overlap there, but want to recognize that there's huge efforts going on in all of these areas also. And that we want to make sure that we're trying to hit that intersection where these are coming together. The report that we have before you today took the effort of many people. We might have authored it, right, that we were able to engage and talk to a lot of folks. One of the things we were asked is how do we create lanes, right, to do this work? How do we to define leadership roles to move this forward? Because there's a lot to be done, and it's interconnected. All of us have to, it's a system that's not working. How do we help provide some scope of how to move this work forward with that? So Sedgwick County has long been a leader in the mental health and the substance abuse area. You know, with the created the Crisis Center back in 2015, leadership of Chairman Dennis, that they have been actively engaged in moving that forward. Similarly, the city of Wichita has had a lot to do with the homelessness and how to do that. So for a framework, we have proposed this idea of how the county can continue to take lead with that. And as we move into recommendations on homelessness, how the city might be able to step forward with that, knowing that it's going to take the entire community and all sectors to move this work forward. But how do we create leadership lanes to do that? Jeff and Robin are going to move you through the strategies in here. The strategies that are developed from the Mental Health and Substance Abuse Coalition are part of our strategic plan. Our effort was to try to operationalize these, put these into a time frame and where possible, to put dollar amounts that we know that are there. We've developed these into short-term, mid-range, and then future strategies to move that work. And again, this is based upon the work that has been long done with the Mental Health and Substance Abuse Strategic Plan. So Robin and if you want to come up and talk about this.
Good morning, and thank you for inviting us back again. My name is Robin Chadwick. I serve as the president of Ascension Via Christi St. Joseph, largest provider in town for behavioral health services on the inpatient level. So just to give you that background so you know where I come from on this. I also am a member of the board, the executive board for the coalition. If you go to the coalition website and look at the information tab, you will see our policy priorities. Those have been, I think, very well circulated into PICA. We want you to have access and vision to those as well. We're going to go through our short-term strategy priorities, and these are the things that we hope to really begin work on and make some progress on over the next 12 months. So we're going to start with the workforce. When you look at this screen, Ascension Via Christi and ComCare certainly employ probably one of the largest numbers, as single entities, largest numbers of professionals within behavioral health. There are a multitude of other community agencies, Mental Health Association, Prairie View Outpatient Services, lots of other places that employ behavioral health. But just to look at some of the big hitters in town, at Via Christi we have 30% vacancy rate for behavioral health specialists, ComCare almost 37% vacancy. We're seeing people retire much earlier. We're seeing low application rates and just a lot of turnover. When you think about why people leave this work, it is, I'm going to back up a second. When you think about why people leave this work, it is very hard work. You're in a situation where you might be physically assaulted, you might be spit on, you might have your hair pulled, you might be shoved. I've watched a video where in my institution, physicians, nurses, social workers have been shoved into walls, knocked to the ground, kicked, hair pulled. I've seen a clump of hair pulled out. It is hard work. It is physically taxing. It is emotionally exhausting. And so I have such respect for the nurses and social workers who stay in this field year after year after year, many decade after decade. But I am also not surprised when someone comes and after 10 months of experiencing those things I described, they say, I can't do this. And so turnover in the first few years is really high. We have partnered with the Kansas, a group out of KU, Kansas Behavioral Health for Children, and they really have done a lot of work. When the coalition began, we had workforce as one of our areas, and this group, a partner of ours, was also working on this area, and so we said, let's join your work, not recreate this wheel. And so they have really studied and surveyed many of the organizations in our community to say, what do you have and what do you need? And so these blue lines indicate positions that are open. That's what they currently have, but they can't fill those positions. And then really the orange is what do we need? And we do community health needs surveys every 3 years at Via Christi, and these numbers line up exactly with that. We survey how many specialists, how many professionals do we have in these fields, and then based on the population in our metropolitan area, how many do we need to serve this population? So you can see, just by looking at the colors, what we really need to have far outweighs those positions even that are open right now. Primary causes of turnover, things that I've just talked about, they can make higher wages elsewhere. We're talking about county and governmental organizations, not-for-profit hospitals, not-for-profit private sector organizations that provide behavioral health, and so they can go make a lot more money somewhere else. We constantly lose people into private practice. It's a lot easier, it's a day job, nobody's going to hit you, and they've got private insurance to pay for it. So better wages elsewhere is by far the biggest reason. Better benefits somewhere else, stress at the job, and I've already spoken to that. And I think it's fascinating that the need is greater than what we can serve. That one to me is very telling, that our staff and our associates realize the need in our community is overwhelming. And I'm not making a difference. That's what that says to me. So really our ask for workforce, and as I go through these strategies, I'm not going to call out specifically each ask because that is in the report. It's very well labeled. You can read. I don't want to speak down to you, but this one I am going to call out because I think it is so important that we collectively develop and implement a strategy to be able to address these really significant staffing shortages. Nothing is going to get better in our community if we don't have people, feet on the ground, providing these services, whether it's EMS responders as part of our outreach team, if it's sheriff's officers, police officers, therapists in ComCare, nurses on the behavioral health unit at St. Francis or St. Joe. It's not going to get better until we address those. I think we should take some learnings from the STEM work and I've been in healthcare for a long time, and I've sat back and watched the STEM work steal people that might have gone into healthcare. And we haven't done anything on an organized effort. So I think that might be a model that we could look at and say, how do we get to the elementary age kids and get them interested in going into healthcare or behavioral health, just like the STEM work has done, because it's been very successful. So as we go through short-term strategy, we really have focused on coordination, communication, and collaboration. There are a lot of service providers within our region, but as we have said to you before, they're very siloed. We don't always talk to one another because the need is so great of the patients that are in the clients that are right in front of us. So it's hard to take that time to collaborate, communicate, and coordinate the care. But that's what we have to do so that we don't continue to have the same outcomes that we have right now. So some of the things that are very detailed in the report that you have is an ask for sustaining funds for the Mental Health and Substance Abuse Coalition. That ask is to make sure that we have staff to continue the work, that we have leadership, that we have the engagement with the WSU Public Policy Management Center, and that we have the ability to drive and lead this work. And our ask there is about $150,000 a year. The second item is dashboard. We need a way through the United Way 211 system. There's a lot of information there, but it's very global. And so when you have someone on the phone, you really don't know what's the right agency. So a dashboard would help with that. IRIS is a system that's already in place. Currently, about 66 organizations in our community use this, with additional organizations being added fairly often. And it really is a way to track referrals and know that something happened. So if I refer a client to another organization, they're going to accept that, and then I can see, yes, they did it. So I don't have to follow back up with that client to make sure something happened. Annual service provider information and gap analysis. We know, and you know, that we need to be able to measure what we do. We don't want to throw money at a plan and then never go back and look to see if it worked. So on an annual basis, we would like to do a study, not one of us, probably someone else, a third party, to do a study to see, is what we're doing working, or do we need to tweak or adjust or throw out ideas, because we want to spend the money wisely and well and make sure that in our community we're making a difference. We have an ask for 2 additional addictions counselors for the Substance Abuse Center of Kansas to be funded. That will open 16 additional inpatient beds in our community. Right now, if you're a male and have no insurance or you're underinsured, and you have finally reached that point in your life where you say, I need help, I need addictions treatment, the wait is about 30 to 45 days. So we're going to ask an addict who's finally hit rock bottom to hang on to that motivation for about 45 days to get to a treatment bed. How successful do you think that is? Not very. Most don't show up when it's their turn. This also has a very direct impact on our jail, because there are people in Sedgwick County Detention who are waiting for those same inpatient beds. The longer they wait, the higher your cost and our cost as a community goes, while those inmates sit and wait to go to inpatient treatment. Another ask is for a jail reentry specialist. Right now, we release people out, and it's kind of a, we hope you do well. Good luck. So a jail reentry specialist would help them find housing, help them find ways to gain employment, help them find training, but help them get integrated back into the community with some skills and some resources that they need. We're really talking about the very bottom layer of Maslow's hierarchy of needs. How do we address their physical safety and get the things that they need? So jail reentry specialist would certainly make a big difference with that and would likely reduce going back to jail. In your report, there are some statistics, and I hope you pay attention to those, on how many times people go back to jail if they are released from jail to homelessness. The numbers are staggering, and that's additional cost we spend every single day with no great outcome. We want to evaluate and expand the co-responder model. When you look at that data, it is remarkable. 63% of the calls, and there were a little over 200 calls, we looked at one quarter, 63% of those calls were resolved at the site where the client was met. That saves ComCare money, that saves EMS transport, that saves law enforcement, that saves an ER visit to St. Joe, St. Francis, Wesley, somewhere, and it saves an inpatient admission at St. Joe, leaving those beds for other people who need those. So this model works. We have the data that shows it works, but we don't have nearly enough teams in this co-responder model. Community navigators would be a new ask. I know for the ARPA funds, that there were some community navigator positions created to help organizations figure out where do you go for funding. This would be the very same idea. On a global level, some community navigators that are not attached to any single siloed organization, community navigators who could help direct people who are needing services to those services. Then once they get to that service, then there's people within that organization that can help them, but this would help them figure out, how do I navigate all these organizations to figure out which one is the one that I need today? So community navigators. And then we're going to talk a little bit more about the Social Service Hub and the Health Science Education Center on my next slides. This concept of a centralized hub is not something that we made up in our coalition. It is a demonstrated best practice in many cities across the United States. San Antonio, we've talked to you about. Oklahoma City, just to our south, has done great work. Denver, Colorado has done great work. And there are several dozen other communities across the United States who have used this same model. We've talked to many of these organizations to figure out, what did you do right? And if you could start over, what would you do differently? Because as those who have gone ahead of us, we might as well learn from them. So really, when we think about what a hub would look like from these other places across the country, we know, if you look at this slide, kind of to the left, these are the things that really need to be clustered closely together. We want to do warm handoffs. So in healthcare, we talk all the time about handoffs. I'm the nurse going off shift at 7 a.m., you're the nurse coming on shift. I'm gonna do a hot handoff. I'm gonna tell you all about the patient, and you're gonna assume care for the day. Right now in our system, the handoff that we do among our agencies is we say, okay, there's This is the name of the organization. This is the address. I've called, I've gotten you an appointment for 2 weeks from tomorrow at 10 o'clock. It's about 7 miles from here. Here's the information. Good luck. Not a terribly effective handoff. Again, we have little, maybe optimistically a 50-50 chance that that client's going to show up at that place 2 weeks from now. Hot handoff means I do the work with that client that my organization does, and then I walk them across the hall or across the street to the service provider they need to see next. So I know they arrived there, they've met the person who can help them in the next step on their journey, and they're going to get the help that they need. So these things, services would include ID recovery. Number one thing that the homeless people lose is any form of ID. Now, I tried to help a young man a couple of years ago get a bank account. He didn't have a driver's license. He didn't have a birth certificate. I'm a social worker. I kind of know how to navigate the system. It took me 3 months to figure out how to do it and to accomplish it. So if you don't have the skills, you don't have the resources, and you don't have access to people who can help you, your chances of recovering your ID are slim to zero. So ID recovery is huge. Legal support, because they probably have been involved with law enforcement and the legal system and need some help. Short-term childcare. If we're going to offer, and we hope to offer, job training and skills training, they need a way to make sure their children are safe while they go to classes to learn those things. Pet boarding. When we went to San Antonio, I was a little bit surprised at the dog and the cat kennels. But if you think about it, if you're homeless and the one living thing you have in your life is an animal, you're not going to go anywhere or do anything to jeopardize that, because that's the one living thing that cares about you and depends on you. So pet boarding is really important. You can read those other services, but in every model that we've looked at, these things are clustered together. The other things on the right side, county courthouse, jail, city courthouse, those things really need to be in the vicinity, but don't need to be in the core. And then off-site, regional hospital, perhaps long-term addictions treatment, inpatient, permanent supportive housing, and low-income housing. We need those things, and we would recommend those things happen, but they don't need to be part of this cluster in our hub. So here's just a potential rendering of what a new ComCare Crisis Center might look like. We know that our existing ComCare Crisis Center is too small from a geographic space capacity to meet the need. A ComCare Crisis Center would be a focal point and a central component of a hub area where we cluster these services. And they're really going to address both behavioral health and addiction treatment needs. This is an example from Denver, Colorado. They call theirs the Behavioral Health Solutions Center. Again, when you think about what services need to be in this hub, you can see from their example, housing services, physical health, vocational health, or vocational training, and then a lot of other resources to help them get to where they need to be. And then off-site, again, in a location that doesn't need to be in any close proximity to the hub area, we would talk about a regional hospital, and we have, as part of our policy statement, we are asking that a regional hospital for this part of Kansas be looked at and be approved and built. 25 involuntary beds, 25 competency beds, and 15 restoration beds. Those last 25 beds will really help our legal system and people waiting in jail to get those services at Larned. It would reduce our expenses locally significantly. There's a lot of, I know the question's been asked, why does this need to be in a centralized area? What's wrong with the way we do it now, this scatter approach? Well, I addressed that a minute ago. You send someone 2 blocks away, or 7 miles away, 2 weeks from now, and you hope they get there. If you look at urban sociology at all, if you know anything about that or read about it, in every city across the country, people who are homeless and struggle with issues congregate in the downtown area because that's where the services are. That's where the bus station is. That's where there is access to public services. That's where this building sits. That's where the county courthouse sits. All of those institutions are localized and centralized in our downtown area, and that's where people congregate because that's where the things they need are. In addition, there's downtown hospital, downtown safety net clinics. So there's a plethora of research that shows why downtown area is the right space for this to be. Then if we think about our mid-range strategy, now we're looking a year or so out. Provider database. So we have been working with, I say we, really Brenda and Misty have done the brunt of that work in working with Johnson County on a provider database called My Resource Connect. That will allow us really to coordinate and communicate with one another about the clients and patients that we're serving so that we can know what everyone is doing. And I think I mentioned this the last time I was here. It's been through everyone's legal, so we know that we have a release of information so that we could share information about individuals so that their private confidential information is protected and given with permission. Additional residential inpatient addiction beds, we need that. Again, I've addressed why we need that, 45-day wait, spending a lot of money in the jail, and then transportation. Our transportation is a challenge for someone with no money and who doesn't live in the right area near a bus stop to access. And I'm going to turn this over to Sheriff Easter to talk about next steps.
So you've heard a lot about what the coalition has been working on. We have some members here today that are part of the board. One thing that I want to emphasize on some of the last slides is the amount of drug addiction that we have in this community. It is very large. It is driving almost all of our crime. And so we talk a lot about mental health care, but we also, in that same context, we have to talk about drug addiction. And when we talk about treatment services, there is very little here in the city of Wichita, other than what Harold Casey's group does for the folks that don't have insurance. And that's mainly what we're dealing with in the criminal element. And so one of the other big topics is medical detox. Why that's so important is the only place you can get it right now is inside the hospitals, which is a very expensive option. So there needs to be some medical detox that's done within the community. In-custody drug treatment program. Currently, right now, we do not offer anything like that inside of the jail. What we offer is volunteers to come in to do Alcoholics Anonymous or Narcotics Anonymous, those type of things. We do have a lot of folks inside that jail that are detoxing because they can't get to the drug. And once we get them to a point where they can be out in general population, because most of those folks go through DTs and those type of things while they're in there, so they have to have a lot of medical attention provided to them. A lot of those folks end up realizing, okay, I need to do something different here. And as Robin pointed out, most of those folks are released fairly quickly, and it's a 30 to 45-day wait to go to Harold to receive that treatment. And so that is a big issue. We tell them where the address is, we get them in contact with them, and then they get set up on a date in the future to go get some rehab. The problem with that is that they never show up. They usually show back up to jail first, intoxicated again and or under the influence of drugs. And so that is important. Is that something that could be done by an outside entity that already provides drug treatment in the community? It could be. So it takes collaboration, it takes partnerships that we need to develop. Another thing that I'll talk about here is the regional hospital. We have been for almost 4 years now talking about a regional hospital with the state here in Wichita. In the Banc report, there's a lot of information about why we need something like that here. Currently, the wait times at Osawatomie are very high. Right now, anybody that's has mental issues that a judge has declared needs to be evaluated, their court ends. And now they have to wait to go to Larned to be evaluated. We have people that's been in there almost a year waiting to be evaluated. We have folks that have been evaluated numerous times. We have an individual that has been with us for 7 years for a charge of murder because of those reasons. And so not only to be evaluated, but what they call restoration. Restoration can only be done at Larned at this point. So in the ask that we're asking from the state is that they provide 25 beds for involuntary commitments, which now have to go to Osawatomie, and the wait time is very long, and also 25 beds to do evaluation and competency restoration. And so we think that will help us as a community. It will help government, I'll be honest with you, when it comes to getting these things done quicker, and either, if they're not competent, start that process with Larned, or if they are found to be competent to stand trial, then we can start the trial process. Right now, we have 100, and after the last two the other night, so we have 121 murder suspects in the jail. We contain more murder suspects than some of the state prisons. And so we have an absolute problem with violence here. There's no doubt about it. And some of it is tied. The last one up, obviously, of course, was tied to homelessness and probably some drug addiction and probably some mental health issues. But that is driving a lot of those numbers. We have to do something different in this community to address those issues if we're going to have a real effect on violent crime here. The regional hospital aspect, again, that's not something that needs to be, in our opinion, in the downtown corridor area. There's been a lot of back and forth on where the hub should go, or the campus, as we was calling it before. The regional hospital, I know Jeff Lang's group is lobbying hard to get that down south. The regional hospital would be a great fit down south, in our opinion, because of what Robin said. With all the services that are here, unless we have big business come in and say, hey, we will buy all of the nonprofits that want to be a part of this, their buildings, everything else, and build you something new, their services are here in the downtown area. We've been speaking with, and I'm sure there's some business folks here, and listening to their concerns as well. And so there's a lot of issues here as government entities that you're going to have to tackle on this. All we can do is give you best practices, what our ideas are, and where the services are currently located, and how we can co-locate. So with that, I will turn that back over to Misty.
So when we met with you in the fall to give you the update on the coalition, there was the ask made for us to look at downtown homelessness as well. Coalition has been meeting for a couple of years to get to these recommendations and understanding. We've dove into the issue of specifically downtown homelessness during the last quarter of the year, and are coming back to you with that information here. So we had 3 meetings with what we thought were the major stakeholders that we could pull together on this. We tried to pull in folks from public safety, direct providers, and folks that within downtown Wichita, the business organizations, to have conversations about what this meant for them. During that time, we tried to, just get an understanding of what we were talking about, and what we were trying to address. And so just want to thank all those folks who participated in this and trying to get our arms around a very difficult issue that has many, multiple efforts involved with it, but has significant impact on our downtown community and those folks that are experiencing homelessness. This was the definition that we came up with, and really focus in on transient populations. Not everybody that we see in the downtown area that we think might be homeless, that's not necessarily true. And trying to understand the nuances in that is really important. Trying to think about how do we help the people involved, and then also the impact that this is having on our community was really the focus of the work. One of the things that we did was try to think about who are we talking about within these categories of transient populations, because the work that needs to happen or the solutions look very different. So what we heard from providers, law enforcement, folks who reside and have businesses there is that there are different categories of this. There are predators involved who are preying on folks. There are folks that have significant behavioral issues that might be in danger. There are those that might be creating some type of nuisance type of activity. There are folks that are panhandlers who may or may not be homeless. And then there are folks who may just be congregating as a part of the social world in the downtown area. And all of these take different approaches of how we might be able to help address these issues. Also want to recognize there's a lot of work going on already in this. So there are several organizations that serve the homeless population that were involved with this work. There is home ARPA funds that have recently become available that can help provide extra services here. And then there's Project Hope led by the city of Wichita, which also is specifically looking within the downtown area. So I want to make sure we're coordinating with those and recognize that those are activities that are already happening, and those folks were in the room for that. So where do we go from here? I think we've got it as far as we could in a very short time period, but this needs work, right? And we need people consistently meeting to help move that forward. About a decade ago, the city and the county came together to create the homeless task force. They implemented several of those ideas, but then the task force stopped, and here we are again trying to address those issues. So some type of ongoing support to keep these issues moving forward, similar to what's being done with the Mental Health and Substance Abuse Coalition, because somebody has to be pushing, leading, and moving this to keep this addressed, and it belongs to a lot of different people. We have been very fortunate to be able to get the shelter providers in the room to talk about this and identified several items with their leadership of things that could be looked at differently for that, whether that is outreach activities, intake activities, case management, that there can be some different coordination if they are consistently coming together to address that. There are several evidence-based programs out there across the nation that have had good results. Functional Zero is one that we looked at. Think there could be great opportunities. There could be others out there as well. But the idea is to help rapidly move people who are ready for housing and ready for shelter into housing in a way that is systematic and has a long-term impact, so we aren't just repeating this crisis effort. As we mentioned before, there is overlap, right, with the Mental Health and Substance Abuse Coalition. So when we talk about things like the Social Service Hub, that needs to be conversations that are coordinated and that are acting together with that. So we don't want to repeat all of the same, recommendations you just heard, but just know we think that that's important and that we are coordinating these efforts too. One of the recommendations that came out of the task force 10 to 12 years ago was sustainable resources, specifically in the areas for emergency shelter and low barrier housing options. So people who have criminal records or who have been evicted from housing, right? Those are folks that are hard to house, and our providers can tell you the challenges that they have for that. We need funding for that emergency shelter and to house those that are difficult to house through low barrier housing options so that folks have a place to be. And then the last part of the recommendations that we had from other communities is enforcement ordinances to have people have public safety have a effort to be able to move people who are experiencing homeless into some housing or shelter. We can't do that unless there's space for them to go. So that goes back to the idea of needing funding and resources for either emergency shelter or for low barrier housing options. Brenda, you want to talk this part?
So one of the things that we found out when we were talking with people out in the community is, and first of all, I just want to say, coming from law enforcement, I understand the pressure and understaffing that is being experienced in that particular field right now. And so thankful that we have such an incredible both sheriff's office and the Wichita Police Department out there. But just really expanding and maybe reaching out a little bit to the business owners, understanding who their community policing officers are and how they can contact when they don't necessarily have an emergency, but would like to have contact with a police officer. The other thing that I found kind of interesting when we were talking to downtown businesses was that they were very interested in how do they respond to someone who is in crisis, whether that is a mental health issue or a substance use disorder. How do they respond? How can they best interact with an individual who is outside of their business or who comes inside of their business, and look at some sort of training for that so they can respond to that in an educated way. We also talked about the legal system and coordination for chronic offenders. One of the things the business owners and the nonprofits even said that is an issue within our community is that they will have somebody who gets arrested because a crime is committed in or around their business or organization, and then that individual gets out of jail within 2 hours or less, and it comes right back to that organization. A lot of times this person is in crisis, and it's just a revolving door. So how do we shut that door down in a legal fashion, of course? But how can we do that coordinating with all of these entities, law enforcement, the jail, the court systems, probation, parole? How do we get that person the help that they need, pull them out of that revolving door? The other thing is addressing predators. During the meetings that we had with the shelter providers and some of the other organizations, nonprofits downtown, is that they said, that there's really like 20 people in our community that are causing the bulk of the issue in the transient population. So how do we address those 20 people? Because if we address 20 people, we address 80% of the problem. So how do we do that, and then coordinating that effort as well? The other thing that came up is a lot of times that people that are in this, in the transient population really have an aversion to calling 911 or reporting a crime. So how do we reach out so that is actually done and provide security for those folks as well? The other thing is coordinated street outreach. We have so many incredible organizations in this community that do so much good work. How can we coordinate that so they are out at different times and giving specific coverage to that population in a coordinated fashion? And I think that's something that the Homelessness Task Force can absolutely take on, and I know that the providers are absolutely open to as well. The last thing that we discussed was the panhandlers that are in our communities. Again, there's been some work done on that, but studies show that if you give somebody a $5 bill that's sitting on a corner, it is not going to go to what you want it to go to. It's probably going to go to something nefarious. So please, how do we as a community funnel those funds and get the help those people need? The other thing is, and just to throw this out here, when people go down and give things to people, and it's done out of a goodness of heart and absolutely with good intent, but it's not driving them to the providers to provide for them. And when that happens, they don't get the help that they need. They don't get entered into case management. You're just giving somebody a fish instead of teaching them how to fish. So that's one of the things that we want to look at, maybe an app or something where people can donate instead of giving that $5 bill out on the street corner. To close it up, send it back to Jeff.
Okay, the last couple things we'll talk about today is how we move forward. One of the things that this slide that you can read really how I think about it. In this community since 1994, we've been practicing a community policing model called SARA. Scan, analyze, respond, and assess. Okay? This is no different. We have scanned what the problem is. We might always think we know what the problem is. Once we've done all of our research and have really delved into the problems, we know what all the problems are now. We're in the analysis stage. We're providing you the analysis that we have done, and now we're asking for a response. All of those things have to be assessed. There's no doubt about it. So anything that's done this time forward, because we're using taxpayer money, has to have measurements and has to understand if we are doing the right thing or if we need to shift direction. That's also part of SARA. Sometimes you think the response is correct and it's not, and we have to shift direction. But all of that entails everybody in this room, the community, the business community, our nonprofits, and mainly you, because it's taxpayer money that we're asking you to put forth to combat this problem. The ask is to approve the overall direction of this plan. Again, until we know exactly where the governing bodies want to go, as far as location, what it's going to cost, those type of things, we can't analyze that for you because we don't know until we have a decision here. The other thing is what the overall costs to run a facility like this. We have ideas from other places that we've looked into, but it all depends on what it is that's going to be brought into this area or into this hub. And that's got to be not just government money. That has to be with the business community, with the nonprofits working together and pooling our resources together. We have to be committed to building partnerships with other entities that provide services, whether it's they take insurance only or they take no insurance. We are at a point where we have to start moving on this. And it's going to take true leadership that all of you possess to move this community forward and get us to a point that maybe we can start combating some of the issues that we're seeing in the last 2 or 3 years with the crime rates. We also have to make decisions that are for the long term. We have to make those decisions, right decisions. Sometimes we do have to put more time and money up front to get the outcome that we want. We have been putting Band-Aid approaches on mental health care for years here. ComCare has tried to do a very good, adequate, good job with the resources that they have. They're overwhelmed at this point. And it's not disparaging ComCare or anything else. A lot of things that they're trying to do is somewhat Band-Aid approaches. And that Band-Aid is getting ripped off every day. And so we have to have long-term goals, have to have long-term expectations, and we have to have long-term money and resources to combat this problem. I will tell you that this isn't anything new. In the late 90s, we were starting to have these issues. They progressed in the 2000s, and now we're in 2022, and you're seeing the culmination of everything that's gone wrong or resources not put towards these issues. Now we're living it now. And so we have an opportunity to reverse some of that, but that lies with you. And so with that, I'd like to thank you for listening to us today. And if there's any questions, we will stand for any questions that you might have. And if I jokingly, I kind of feel like Gladys Knight and They're My Pips, except we're opposite because it's the guy and 3 gals. So if you guys don't mind coming back up here, I appreciate it.
All right, we'll open up to questions. Who wants to start?
I have one.
Commissioner Cruz.
Sheriff, can you talk to us about how much it costs per day for someone to stay in the jail, and what is the average length of stay?
Yeah, so it's about $73, $72 and some change per day per inmate to house individuals. Our average length of stay has been, it's not real steady right now because of COVID and those other things. Average length of stay is approximately 34 days. But you have to understand, we have about 32,000 bookings a year, or people being booked into jail. Some of those folks are with us for an hour. Some of those folks are with us for 7 years. And so that's what drives our ADP.
And so out of those days, how are they filling their days? How are they spending their days? If we have those, what's the percentage of folks in our jail with a substance use disorder?
Yeah, so mainly right now, because of COVID, all of our volunteer services quit coming in. So we really haven't had too many volunteer services. So a lot of our programs ended. So now they spend their day pretty much in the pod area or in their cell at this point. They still have chapel, are able to go to some of those things, but a lot of the programs we had, like the mentoring program, those type of things, it all took volunteers, and they were not comfortable, which I don't necessarily blame them, of coming into the jail and providing those services.
So those addicted to something might detox because of the length of stay, and then when they get out, how often do they come back? And how quickly do they come back?
Yeah, when it comes to mental health issues, we work very well with ComCare. We make arrangements. We get them over to ComCare because they're less than a block away from the jail. When it comes to substance abuse issues, we give them the property back and say, good luck to you. And these are the services that are out there that you can apply for.
I know we've talked about having a dedicated time when folks are discharged from the jail. Are those still happening at sort of all hours? When are people
Yes.
released from jail?
Yeah,
They're just happening at...
I don't think there's any way that we can just have one dedicated time because last night I worked in the jail till 10:30 at night. We have 100 people in booking alone. And so if you dedicated just 8 to 5, then all those folks after 5 o'clock are going to be sitting there and booking until 8 the next morning, and we'll have 200 people in booking. So those folks have to be discharged 24 hours a day to keep the jail operating.
Okay. We had talked about the high utilizer study and some of these, the data that we've collected shows us one thing as far as cost. When we talk about $17 million of unfunded care, it's roughly was about $34,000 per person that was in that study. So if you think about per person we're spending, and there was one person in there that spent what, $750,000, so $750,000 out of that study. So you and I have talked about the cost of the criminal justice system, because that really isn't calculated here. I mean, we don't have that information, and people keep coming in and out of our jail. If we have a 60% recidivism rate after 2 years, what is the cost of our jail currently? So we talked about maybe following 200 people that go through our criminal justice system, from the time they're picked up from PD to the time they, spend through our court system, whatever. I wonder what that would, what kind of cost would render with that. So when we talk about the cost to our system, and I've been saying this quite a bit, we're essentially budgeting for the consequences. Like, we're just budgeting to pay what we know is going to happen. And so shifting that to the front end as far as prevention efforts is precisely what this plan is doing. I do have some more comments, but I don't want to be,
Other
hogging the
questions?
mic.
Sheriff, do you think that only one reentry expert for leaving the jail is enough?
Yes, if those folks are being released between 8 and 5 in the weekends, again, the issue is we have to release 24/7. And so if someone comes in to post bond on somebody that's struggling with drug addiction, and they're going to post it at 2 in the morning, and again, a lot of those folks are in and out of our jail within a few hours. And so when we talk about a specialist in the jail, those are for the chronic folks that have been with us for a little bit, you know, people that got committed from judges in the city of Wichita. We know what their release date is. That's the difference between prison and jail. Most of the time, we don't know when their release date is. And so I think it would help with the chronic issues that we see, the folks that are just coming through nonstop. But to say that that's going to help everyone, it's not, unless you have somebody there 24/7. And right now, we have a hard time staffing people that want to work late shifts and the weekends. So it's a difficult ask.
And I don't know who to direct this one to, so anybody's an expert on, please step up to the podium. Now, with the CCBHC bill that the state passed last year, does that have any impact? That was a bill that provides additional funding for, I believe, 28 additional clinics throughout the state, nonprofit clinics focused on mental health. Has that impacted our study or our plan here at all?
I'll leave that one up to them.
If my understanding, right, that will help within our ComCare system with different designation and funding that will be available. I think it will help. And if, Tom, you want to help jump in on this one, or Tim, I think that, yeah, that will be definitely a help for that. It would not take the place of the recommendations that we have in here. It would be additional services and help, but not these other items. It would not take the place of these items that we have in there.
Good morning, Commissioners and councilpersons. Tim Kaufman with Sedgwick County. The CCBHC designation will change the funding mechanism for community mental health centers, and it will allow for expanded services. We're going to increase some treatment teams that have not existed in the past, so there's additional funding. So over time, when that funding model kicks in, there will be additional resources to add staff to deliver additional services. It's not necessarily tied directly to any of the issues that we're talking about today, but it's addressed more specifically to general community mental health services that ComCare provides on a routine basis.
Thank you. Commissioner Meitzner.
Thank you, Mr. Chairman, and appreciate. I just have two questions, and it's nice to be together with you all. Councilmember Ballard and Hohausen. We've not met formally, but nice to work with you. My question, two questions, I think, Robin, you could help address. On your cluster slide, and I was kind of following along the presentation with the big stuff, so this is very helpful. But the write-up on page 20 says that the anchor to this effort is the Crisis Center, which I think we all know, and the Substance Abuse Center in Kansas, SAC. But I don't see, is SAC on this cluster?
It would be located within the ComCare Crisis Building.
Okay, that's what I was, all right, that's helpful. And then the other thing, Robin, Commissioner Dennis and I, or Chairman Dennis and I, we've been in Topeka and had a number of conversations, and I know you're having them. And we kept saying that a 50 bid is what we believe we need, and we kept getting questions, is 50 enough and 50 enough? So we're kind of leaning on, we use the name Robin Chadwick and others.
No.
Because we were trusting you, but I like, I just want to reemphasize or be reconfirmed that you all believe 50 is an adequate number that will move our needle in a positive way.
As best our crystal ball will work, we think 50, and there's a lot of people that have talked about what's the right number.
Yeah.
We talked about 25, we talked about 100. We've worked closely with Jen Wilson and Joan Tammany at ComCare to kind of, because between them and the jail and St. Joe, we really are the primary people who send people to OSH or occasionally Larned. We think that's the right number. Now, we could be proved wrong, but that's what we think right now.
Well, and I think there's bipartisan support for that, but I think they wanted to be reassured that that number would be good, and then, of course, how much is that going to cost? But as long as, this is really helpful. This is very thorough and a lot of work in this last 60, 90 days. It helps clarify a lot of stuff, at least for me, so. But the 50 bed is important. It's alive right now, and it's ready to be voted on, I think. So between us all, that's important. So thank you for clarifying. Thank you for.
Can I make another comment about that? Because if we build another 50-bed hospital, we have to address workforce.
Well, that was asked to.
We have to address workforce.
And let me follow up with what Commissioner Meitzner just mentioned, and I'll mention workforce at the same time. The questions came up a number of times when we were in Topeka last week on 50 beds. Is that the adequate number? So what I asked yesterday during our commission meeting was that we get a one-pager that describes that regional mental health facility and explain the 50 beds and how that we're going to use it. I tried to tell them when we were in Topeka that we don't want to be the only one in the state, that we call it a regional mental health facility, because I guarantee the sheriff out in Garden City would be very unhappy if he didn't have something in his area when we were putting something in our area. So they need to be spread out across the state. Along that same line, we talked about workforce quite a bit also, and where we're going in the future and finding the workforce. Representative Landwehr asked us several times, what is the requirements for the education level for the different jobs that we have? Do they all have to have a master's? Right now, it looks like a lot of them are having to have a master's. So we need to break down another one-pager that describes what kind of workforce that we need and what the education qualifications are of that workforce so that we can put it together. Then that folds into another request that we had, which everything that I'm talking about has bipartisan support, okay? So we just have to make sure that we provide them the tools in order to be able to do what we need done here. So as we talk about the workforce, one of the things that we're pushing for, and I think it has tremendous support, is a downtown health science center. And that's going to help us, not immediately, but in the long term, to provide us the pipeline that we need for these social workers and other medical professionals that are going to help us work through this. One of the requests is that our ComCare Crisis Center is located with that health science center, so that the people that are going through that educational program can work right with our folks and help with their education process. They won't be qualified immediately, but it works towards their education level. So we need to make sure that we have that documented as we move forward. I appreciate that you had education forgiveness, loan forgiveness on your slides. That's another way that we can help with the long-term paying benefits. That's a local issue. We've recognized that. Our budget is being worked right now, and that's one of the issues on the budget currently. One of the points that I want to make sure that everybody understands, and I appreciate that you're asking for things out of government right now, but government can't do it all. As we move forward, obviously the nonprofits have to be involved in what we're doing, but more than that, the private businesses have to be on board with whatever our decisions are as we move forward. We're going to need their funding more than anything else. We've got a lot of stresses on government finances. Right now it's a great time because we've got some ARPA money that maybe we can do some things with. But again, I think I appreciate everything that you all are doing on this. As we move forward, I know that you briefed on the hub idea, and we've had a lot of discussions at the county level on what we're going to do for campus or hub, however you want to call it. And we truly, all of our discussions haven't been transparent at this point. So it's time that we make our discussions transparent so that everybody knows what we're looking at for the future for that. So besides a number of one-pagers that I think that we need to task some people for, another task that I think we need to move forward with is we need an RFI sent out to the community on what the future holds for, however you call it, a hub or a campus, to describe what we put in the RFI, what kind of services we need, what kind of land type that we need, and let the community tell us what's available. We tried it on our own and it's not working. So I would love to have an RFI submitted, and our county can put that out very easily. We can task them to get an RFI out, and that way it's transparent. As we move forward, we'll know what the costs are, we'll know what the benefits are, and we'll kind of have some idea of a location. So those are some of the things that I think we need to move forward with. I also appreciate that you've hired Dawn. What we've needed, I think, and Robin and the sheriff and I, we traveled down to San Antonio 5 years ago. So we've been talking about this for a long time. We brought Leon Evans in from San Antonio, then out to Via Christi to tell us what we needed to do. We went back down to San Antonio with the Chamber of Commerce. So we've got kind of an idea of what needs to happen down there. That's another one of the one-pagers, is exactly what we need in this campus location that we can provide to the legislature. But we've been talking about it a long time, and we've needed a Leon Evans here in Wichita. He pretty well pushed forward that we need those private donors like Valero and so forth, but we need the person to do this. So I told Dawn already, I look for her to be Leon Evans for Wichita and Sedgwick County. So I hope she didn't faint behind me. But as we move forward, there's a lot of work to be done, and it's a joint effort between the city and the county, because each of us have been kind of working this in isolation. We need to work it as a group, so I appreciate the fact that we've got this en banc that we've talked about today. I've probably talked enough, but those are some ideas that I have, but I don't think we're going to go anywhere right now without some kind of an RFI, so that we can get a good grasp of what's available out there, what it's going to cost, and where it's going to be located. Any other questions?
I have Commissioner Howell.
Thank you very much for the chance to speak. I have not had the privilege to serve on the coalition, so some of this is new to me. And I appreciate the presentation. You guys have done a great job bringing this to us today. So my first question is for the sheriff. Your very first slide, you talked about domestic violence, youth violence, and gun violence. I didn't hear anything in the PowerPoint after that first slide that relates to those directly. Can you?
Yeah, we're not taking on those three subjects.
Okay. That was your point to make.
Yeah.
Okay. All right. Thanks for clarifying that. One of the things we've talked about today a lot is the how to deal with the after effects of homelessness, substance abuse, and mental health. But I haven't heard anything today about prevention on the front end of those issues. Has there been some discussion by the coalition on what is causing these things to be prevalent in our community, and what can we do to address those on the front end? I have a few other questions after that. Thank you.
You know, I think there are initiatives that are already in place in our schools. We have mental health providers. ComCare provides behavioral health specialists in our schools. Schools employ social workers and counselors. So I think there is a lot of work going on within our school systems. There are Stop Suicide, I can't think of the names of them right now, but zero suicide initiatives that are going on. These last 2 years, the number of Americans who are struggling with mental health has skyrocketed because of the pandemic. Isolation, hopelessness, loss of loved ones through death to COVID. So I think there are a lot of initiatives nationally and locally to try to deal with mental health. our coalition's guiding principle and mission really is to try to look at those that are in crisis and how do we stop that spiral down when someone hits that crisis point. But I agree with you. Prevention measures is what will stop them from getting to that point in the first place. That's just not the piece that our coalition has taken on, but we certainly partner with and support those groups that do that work.
Well, thank you for the answer. I think there's a lot to be considered on that question. I don't think it's an easy answer, but I have a theory that a lot of the mental health issues, again, I'm not saying all of them, but I think many of them stem from a substance abuse problem that maybe started out being a problem and they ended up with a mental health problem down the road. You know, in terms of chain of events, I can't prove that, but anecdotally, I sense that the drug addictions and substance abuse problems may be almost maybe more a basic concern that ties into mental health and homelessness. But the drug problems in our community, I think, are rampant, as you keep saying, Sheriff. Thank you for that. I also think that juvenile justice is a pretty big topic, and we've not talked about that today at all. But juvenile justice, you know, foster care program, there's a lot of opportunities. I think we need to talk about that at some point. I have a question I'm not sure if it's for the chairman or who it would be for, but for the city and the county, how many years have we had these mental health asks to the state of Kansas? How many years have we had that on our platform to the state? It's been at least 4 or 5, maybe 6 years.
I think every year since I've been here.
Right. Is that true for the city as well?
Bob? Bob's the source of institutional knowledge.
Probably more on the homelessness side of it.
I guess my point is, you know, I look at Osawatomie and Larned, and I don't think the state has done a great job of investing in those two facilities. They are understaffed and undermanned and underpaid. There's a lot there that needs to be better than it is today. And you know, to look to the state to do something like that here isn't the greatest solution. And if they funded it in a way we would like, perhaps it would become that. But I guess I don't have a lot of faith that that's going to come forward necessarily this year. Maybe it will. I have hope for the state, but I don't know that I want to wait for the state either. Now, they're in session right now, and maybe we'll see something good come out of the state this year. But if not, then what? And the reason I ask that question is because, well, let me ask another question before I get to my point here. Is there anything that's been presented today in terms of the campus or a mental health hospital that requires the state to do it? Or does the county and the city have the authority under the statutes to do those things that we're looking to do? I mean, does the state have to do it, or do we have the legal right to do it? If we had the money, do we have the legal right to do those services in our community? Does it require the state to do it?
I think in our presentation, really the primary thing that we are going to need the state's involvement in is the state regional hospital. Now, I can't speak to what laws or rules govern the activities that you can have, but that's the big ticket item that we're asking the state to fund.
So again, let me rephrase my question. If we had again, this is really a money question. So if we had the money, could we do a mental health hospital, or does it have to be the state of Kansas that does that? Money aside, do we have the authority to set up a mental health hospital if we had the money?
So you do have state statutes that govern involuntary commitments, those type of things, which that is how the state, where they come into play. Right now, they're contracting with Via Christi to do some of those involuntary commitments. But when it comes to those type of things, yes, that's a state issue. When it comes to what ComCare already does, what SAC already does, no, that's a local issue that is not governed by state statutes. Well, ComCare has state statutes they're governed by, but as far as what we're asking to do with this hub and bringing all this together, that's not a state issue.
So let me. Yeah, I'm going to guess that maybe licensing and certification and maybe some oversight at the state might be required. But in terms of, providing capital, to build a facility or to find a facility and to operate that facility. I would guess that they would be fine with, if we had the money, we wanted to do that, they would be okay with that, I'm guessing. But I'm sure they would want to retain some type of oversight, licensing, certification type of, to be recognized by our courts and have those involuntary commitments potentially.
Well, I think those are two separate issues, Commissioner. When it comes to regional state hospital, absolutely, they'd have to have the oversight.
Right.
When it comes to what we do kind of in silos right now, they have no oversight over that.
The reason I asked the question is, and this coalition's been meeting for a number of years, and I think you stated that earlier, I don't know exactly how long, but 2 or 3 years at least, I'm guessing. At this point, we ought to have an idea. I know the capital investment is a pretty big question. We don't know how big this campus will be necessarily, or exactly how it's going to lay out, because we don't even have a location yet. But capital is part of the question. The other part of this is operation. And I would just ask, is there anybody has an idea what's the vision for capital and what's the vision for operation for city and county governments? I mean, what you're saying, you're asking for a fiscal commitment, so to speak, in this presentation today, but what can you characterize that? Is it $5 million a year in city and county each? Is it $30 million a year? Does anybody have an idea what the level of financial need is from city and county?
Commissioner, the short answer is I don't know that. I think it depends on what size we build, what is the role of nonprofits in that work, and all of that. So I think that we would want help in putting that information together to make sure that you had accurate information.
Well, with that in mind, I wish we were further along on that question, because really that is the number one question. It is all about money. And some of this is from the state, some of this is from our own budgets. And so, personally, I'm a little tired of waiting for the state. I don't think we ought to wait for the state. And I've said before, if this community wants to see a solution go forward, then this community can support a ballot measure to create a revenue stream that takes care of this problem. It doesn't require state funding at all. In fact, let me say that the money that goes to the state is our money, and they give it back with their strings attached. And I think we're the net loser of that money path. At the end of the day, they take more money than they'll give back. And so to look to the state to solve this problem really is not necessary. It is one way to do it, but if they're not willing to do it, then we should look to ourselves. And I can envision a ballot question to the people of our community to say, if you want city of Wichita or Sedgwick County to invest in these solutions, then here's an opportunity for you to commit to a revenue stream that would do that. I hate property taxes, and I don't think that's the right answer. But maybe a sales tax would be an idea. For example, a 1-cent sales tax, which is way more than I think we'd ever spend. Right now, generates over $110 million. I think $110 million roughly. I don't think that's the right answer either. But maybe a quarter of a cent sales tax would generate roughly $30 million a year. I think that's more than we would probably need to do this forever. I'm not suggesting we do this. I'm not saying I would even vote yes or no. I have no idea. I'm just saying if we continue to wait for the state, we may wait forever. If this community wants to solve this problem.
Can I address that real briefly?
I have a comment or two after that, but thank you. Go ahead.
Thank you. We went to Topeka specifically to ask for state support. The state has $1.5 billion in ARPA funding sitting there right now, and the state has about $3 billion of excess general fund money right now. Now is the perfect time to be asking the state. If that does not happen, then a fallback can be something that you're suggesting. But right now, we have to keep pushing for the state to help fund this. It is their responsibility for a regional mental health facility.
Let me comment back. So I started off by saying I'm looking to the state to solve it first. We've asked and asked and asked, and this year's a really great year to ask because of what you just said. But assuming that we don't get what we want, if that happens, then we need to talk about what's next. And that's why I bring this up. For a couple of years now, I've been saying, we act like we have no options here, and that's not true. We are government leaders. If this problem needs to be solved, then we should come together and solve it. It doesn't require the state or the federal government to do anything for us. We can do it ourselves, if the people want it solved. And I'm okay with asking the people for what they want. And if they don't want to support it, then we have our answer. But if they want to support it, then we have an opportunity to actually solve the problem. I am tired of waiting with inaction, and I think this problem is getting worse and worse and worse. And so I think at some point, when the state, if and when the state doesn't do what we want them to do, we need to come together and have a different conversation about where to find the revenue to solve this problem. And the other question is this: if we can find the revenue in our existing budgets, that's great. But I have no idea what the magnitude of this is. Can the city and county find, let's say, $15 million in your existing budget to put towards a mental health campus, if that was the right number? I don't know that we have those resources in our budget. Maybe we do. In fact, this year with the assessed value going up, we saw that yesterday, that money probably is actually in the budget right now. I'm not suggesting we do. I'm not suggesting we capture that. I'm not suggesting we would earmark that money for that. But governments have grown and they continue to grow, and the money may be at our fingertips. So I'm a little tired of inaction. And I was going to say, for me personally, let's ask the state. But if and when they don't do what we want them to do, we need to come together and let's solve it without them. Thirdly, and lastly, I'll just say this: we are a government, city and county. If people come out of our system and come out of incarceration from our system, why can we not provide them a government-issued ID from Sedgwick County? We know who they are. They've just served time in our facility. There's no question about their identity. Why can we not provide them some type of government-issued ID to get them started? With that, I'll wait for the question. That's all my comments, and thanks for the chance to speak.
Of course. I do want to add a couple of thoughts and also questions here. First, I'm a little concerned with the current infrastructure. We talk about scaling up, but here in the report, there is on page 15, there is a really well-worded coalition or correlation between jail reentry and mental illness and substance abuse and disorder. And then it says that the lack of staffing, the jail is also understaffed and has been for several years. The lack of staffing has prohibited a robust reentry program. Now, the several years part, I find, and I'm going to ask a larger, more global question with this, interesting, because we're not talking about the current people on the sidelines, COVID, changing the economy. We're talking about years of understaffing that has prevented us from pretty much plugging a hole in the bucket here, where if we had this, then we could actually directly impact and help folks who to not get back into the system. So I'm wondering, what has been the cause of understaffing at the jail, and also it correlates with a presentation we have with ICT-1 last year, where the ICT-1 program was presented as successful, but we couldn't scale it up because of the lack of staffing. So I'm concerned for two things. One, have we figured out the staffing issue, and how can we get more folks in these positions so that our current model is firing on all cylinders, working as good as it can? And should we figure that out, and I'm not saying we should put anything on hold, but should we figure that out by the time if we're able to scale up with either a campus or another model, so that we're not, pretty much running this large ship of services with not enough crew? So that's my concern, and I would appreciate it if you have any thoughts on it.
Yeah, so staffing issues inside the jail have taken place for years, long before I got there as well. We were usually running between 20 to 30, then it moved up to 30 to 40. During 2 years ago with the unrest, you throw in COVID, we can't get below 70. And so a combination of all those things, plus it's not a glamorous job in there. You're dealing with the worst people in the city of Wichita that are housed in there on a permanent, for quite some time. And so there's not a huge draw right now for people to even join law enforcement. And so when you're not wanting to join in law enforcement, that even affects detention facilities even more. This is not a problem simply to Wichita. It's all over the state of Kansas, and especially in the big major cities, they're having the exact same problems. we're talking as managers on, or as leaders of those organizations on what it is we can do. And yeah, pay is a part of it. But we have to change that dialogue of what law enforcement is. And so it's kind of threefold as far as asking for competitive pay wages. You have to understand we create our own openings as well, because most people that come into the jailing services, they want to be law enforcement officers, and that's their step in. And so we have a class of 8 of only 15 people that applied, which used to be 150 would apply for those positions. All 8 of them came from the jail. So we created our own openings. Wichita Police Department takes a lot of our folks from inside the facility as well, along with neighboring cities. So we're not losing them at the rate we were in April of 2020, where they're just quitting to go work for Amazon or Lowe's or those type of things, because we improved the pay somewhat to keep folks there. But we are still losing them to other law enforcement agencies. So I don't know if that answers your question, but that's exactly what we're seeing.
Okay, and
From
so
a law enforcement standpoint, I don't know.
the
The
other,
follow-up question was,
yeah, the other side of the question was to talk about the integrated services that ICT-1 had, and again, it seems like a reoccurring theme, even before COVID has affected the economy as much as it has, is an inability to maintain that pipeline of either law enforcement or jail folks to work in law enforcement or jail, or maintain that pipeline when it comes to social workers, case managers, mental health workers. And my concern is that's directly within our responsibilities, our power now. I'm sure there's budgets for this. What can we be doing to get our current services up at full? And has any thought been put into this, or other cities or counties that they've done success with programs that we haven't tried yet? And then my concern moving forward, and I am for taking this once-in-a-lifetime ARPA moment with Sparks funding to have a transformational addition to our services here. But my concern is if we can't fix the problem with staffing currently, are we going to run the risk of setting ourselves up where we have created a building, we have created this facility, but we haven't been able, we have the similar problem of who's staffing it, who's working for it. And is there thought in how other people have addressed this, that could we be taking a play out of someone else's playbook today, or not today, but immediately to try to address some of this?
yeah, so kind of a couple different answers to that. This is taking place across the nation. There is nobody except for one department that we have found that is not having the attrition rates as everybody else, and that's Nashville, Tennessee. So we've been working diligently with them with their health and wellness program, because we went out there and because of the way their health and wellness program is built to take care of those officers there with wraparound services for them, with treating them as human beings, and with the therapists that they employ. We're starting to do that here because obviously they're doing something right, and talking to the cops out there, that's the one, they feel valued, they feel appreciated, and their families and them are being taken care of when they experience issues. And so that's one thing that we're trying to do here. When we talk about the other entities, Los Angeles County is thinking about firing 4,000 employees for not getting the vaccine. Hey, we'll recruit the hell out of them to get here. So other than that, it is very difficult right now to recruit and retain people. And so I hope that kind of answers a little bit of your question. The last thing I'll say is that the ICT-1 thing absolutely is working. Yes, it's not enough, but it is working, because we're seeing folks that traditionally would be coming to jail are no longer coming to jail. They're being treated in place, so they're not overloading ComCare and they're not overloading the hospitals. Now, how do we staff that? And that's the gist of your question, and I get it. The last thing that I'll say, we are in the process now of looking at turning the whole north tower of the jail into nothing but cameras and pulling those deputies out of those pods just so we have enough people to make rounds, be rovers, respond to incidents. Because I don't think we will ever get back to staffing levels of just 10 to 15 down. It's not going to happen. And so we got to look at other technologies to assist us in doing that.
Mayor, I would just add in, that's why we led with workforce. It is critical that we get this figured out, and there's not one single solution. I think when we, shared the results from the study, yes, it's pay, yes, it's overload, yes, it is concern that they're not having impact. But just as we've had issues in our community when we didn't have enough workers in another sector, this is going to take everybody coming together to whether that's what is the education requirements that might need to be changed? How can we do programs that take, high school, post-secondary students in a different way? So it's got to be a more holistic approach than just an organization and funding, right? That this is a crisis, and that's why we led with that.
Do we have, and I'm looking at the coalition board right now, and I recognize many of these faces, but I'm not sure. Does anybody on here represent all three of our major universities who have campuses in our city have mental health type programs? Is there anybody here who represents, or could we be doing a better job communicating with folks who help create that pipeline? And is there a role that we might be able to do to try to encourage more folks to pursue mental health fields? And one last thing before I let you answer that question. Being out in the community I think it was last week, we were at a forum over at in North Riverside, I believe, at the community center, and the discussion about mental health also went into reaching out to folks who within communities that could be trained as mental health providers, but also have that cultural and language expertise for different communities within our city. And through that discussion, it came out that there are a lot of people who want to do advanced social work training, want to get an MSW, but Pell Grants don't go beyond into the master's level. Is there any model out there where it's kind of a grow your own social worker that we could particularly utilize in this pipeline, but also to diversify the pool of folks who work in this space so that they better represent the communities in which they serve?
I think you have a great idea in adding someone from higher ed. That was a great suggestion, and we'll take action on that. The Grow Your Own, I think, is a great idea. A lot of organizations offer tuition reimbursement. I know Ascension Via Christi does, and I think other organizations do as well. If you work for us and you go to school, we're going to pay part of that tuition back. I think it goes back to we have not done a good job in keeping up with the recruiting efforts to go into technology. Kids really want to go build games and be a coder and do those cool tech things. Working in the jail, working as a social worker in behavioral health, that's not really as glamorous or as cool as writing video games. So we've got to do work to catch up with all those people we've probably lost to STEM careers. Within my organization, and I can only speak for mine, we are every day talking about new models of care because we cannot have a 1-to-5 patient ratio for a nurse. We can't have a 1-to-15 patient ratio for a social worker because we don't have enough. So we're every day talking about what other disciplines can we use. One of the things we're looking at in our emergency department is starting a peer support program where we take people who have lived experience, who have dealt with mental health and substance abuse, and they become part of our workforce. No MSW, no college degree needed for that. Lived experience is what gets you that job. And so we are trying hard to catch up, to create new ways to do the things we've always done. Because the need is still there, but we can't always fill the need in the way we have. So I think every organization is being challenged to do the same thing. Figure out a new way to do what we've been doing.
Thank you, I appreciate that. Now I relinquish the floor.
We'll let Brandon talk first, and then I've got a couple comments on that. Did you have a question?
I did. I'm on comment first.
Well, I just wanted to follow up on a couple of the requests and comments of the mayor. I mentioned the Health Science Center is a long-term solution, and that's going to help us provide as part of this pipeline that we need for social workers. But as far as the sheriff's issue, we just got a briefing this past week from Jeremy Hill on workforce. And basically, we're at full employment today, is what his message is. And being at full employment today means that people that we're recruiting are ones that we would never have recruited in the past in order to try and fill some of these positions. So it's kind of a double-edged sword. On top of that, the sheriff is fighting a lot of other issues. When the governor gives the folks in El Dorado a pay raise, what are they going to do? They're going to leave our jail and they're going to go to El Dorado. I don't want to pick on the city council, but you just gave your police a large pay raise. It's going to affect our sheriff's recruiting because they're all going to come over here as a result of that. So we have an awful lot of different pressures going every single direction, trying to find the few people that are available. The need is this big, the pipeline is this big. And until we can correct that pipeline, and hopefully the new Health Science Center with our ComCare Crisis Center can help that in the long term, but in the short term, I don't know that we've got a good solution. We've paid bonuses, we've increased pay, we've reclassified everyone, so we're taking as many actions as we can to try and fill that need. If the resources aren't out there, it's very hard to do that. I'll turn it back over to Brandon.
To the Brandon's. Before I hand it over to Councilmember Johnson, I just do want to mention before I forget, I would love to chat with you later about it sounds like almost an apprenticeship program. If you have this life experience, how you can pull it in and utilize that experience to participate in the mental health field. Love to chat with you guys later about that and to see if there's a way that we can come alongside a program like that and try to boost our numbers. Councilmember.
Thanks, Mayor.
Happy birthday, by the way.
So I had a question about slide 36. The second bullet point from the bottom provides sustainable resources for emergency and low barrier housing. Is that a dollar question or building housing for folks coming from homelessness with challenged backgrounds?
The sustainable resources for emergency and low barrier housing, so it's both. It's trying to have enough space for emergency shelters for get somebody off the streets into an emergency situation, and like the low barrier housing for folks that have been evicted in the past, may have criminal records, may have reasons why they are not easy to house. Trying to create more space for them to have ongoing housing is one of the major barriers that we heard from providers that we need to address.
Okay, so I asked because just dealing with housing over the years, some of the concern I have is you have so many property owners and landlords that put those restrictions on that opportunity. So even if you put dollars into it, you have so many that won't take people with challenged backgrounds or who are, now sober for so long.
Yeah.
And you only have so much sober housing. So to me, and I'm not saying it should be government run, but is it building more of those housing opportunities with the low barrier requirement? Because even in one of the facilities I dealt with here recently, some of those folks who were trying to get out of a bad situation had either drug abuse, substance abuse issues, or had felony backgrounds, and they couldn't go anywhere. They were stuck. And I think one of them was temporarily homeless for a little bit. So to me, it seems like we need to build more of that with that, because some property owners and landlords don't want folks who have that for whatever reason.
Yes, I think we have homeless providers here in town that do not have facilities or resources to make that happen. So I think that it is both. We need space and we need resources to keep those available.
There's a wonderful 65-unit building on 26th and Grove that needs a lot of love, but it'd be a great place.
Noted, thank you.
What was that, C2? What are you giving away? Commissioner Cruz.
Thank you. I'm thankful for this conversation today, but I just kind of want to thank Brenda, Misty, Zoe, for the endless work that you guys put into this. There is a ton of information, and compiling all that information and formulation of this plan, I know took an incredible amount of time. I also want to recognize the members of the Mental Health and Substance Abuse Coalition that are here in the audience. I see some here. I also want to recognize former Councilwoman Cindy Claycomb for her work. We have dedicated hundreds, if not thousands of hours between all of us, because this work is truly a labor of love. So just thank you for sharing your energy, your expertise, your time to get to where we were today. I feel really blessed and grateful for the opportunity to work with each of you. I have learned more over the past 3 years than I ever imagined. And so I think we've all kind of been waiting for this day, right? I mean, to put this plan in place. Some have said to me, oh, I know this is a passion project for you, and while that is true, it's so much more than that, because as a commissioner, I have a responsibility to allocate our tax dollars in the most efficient and effective way possible. And as we're in this budget cycle right now, I don't want to budget for consequences anymore. This plan is budgeting for solutions. And so, again, please dive in and let me know if you have questions. I'm happy to chat. Even in the best of times, though, there is untreated mental illness, substance abuse, domestic violence, and people experiencing homelessness. But as we've all experienced, this pandemic just keeps sort of lingering, and the stressors are compounded. So I just want to make sure that, you know, what we've all gone through and are still in the midst of has laid the groundwork for some really lasting issues for a lot of people. And let's be real, that the psychological damage will not be shared equally. It just won't. You guys have probably heard that, you know, we're all in the same boat. Well, are we though? Because you have young adults right now that have experienced an education flop. And I mean a flip-flop of how they're doing it. They're no longer in classes, right? How long did they spend outside of their class? I'm not saying education is a flop. I'm saying the way that education was rendered here lately was flipped. We have people experiencing job loss, parents and children, women especially have been really impacted by this because they're caregivers. They had to stay home. Communities of color, essential workers. So I say all of this because I don't even think that we've hit the worst of this yet. I mean, I truly don't think we've hit the worst of this yet. And so I wanted to, as I was gathering my thoughts, I was thinking, what do all of us have in common that are sitting around this table? And the one thing that came to me was, we all slept in a warm bed last night. We all have access to a warm bathroom facility. And if one of us or someone in our family needs help due to an addiction, we would probably have access to get treatment. So if you're like me, this work and this plan presented today is an incredible amount to take in. It's complex and it's overwhelming. So I just kind of wanted to boil things down really quickly. It's about data, and the data that we presented is the way we're making decisions, and it's the formulation of this plan, best practices in other cities. First of all, we don't really know how much this is costing us. Our ineffective system that is essentially a revolving door, we don't know how much that costs us. We have to have a redesign of our criminal justice system because people are trapped in that cycle. It's a shift from punishment to treatment. You asked about prevention. There's a plan in here for treatment of these folks. Hiring addiction counselors. I just asked Mark Bennett Tuesday, I believe. Out of the cases that he is overwhelmed at trying in his office, almost 10% have a drug-related charge. But that's just if they had possession on them at the time when they got picked up. That doesn't include if they were high without possession. And then we talk about workforce, and I'm gonna wrap this up. I'm not gonna speak for a year like I did last time. So the people, so the peer support, I'm really excited about that. That's huge, because when we talk about addiction counselors, when someone has gone through addiction, more than likely they will heal by helping others, and those positions are so important. The co-working space, which is our social service hub, think of Groover Labs, right? It's a co-working space for professionals. That's essentially what we're trying to create, is a Groover Labs, a co-working space for social service providers to give that warm handoff. I wonder how many square feet. I hope that we're looking at the actual size of that building and what it would cost, because I hope that we could get that funded. The technology, so when we talk about this dashboard, it's essentially a website for the community. So is anybody here familiar with A Place for Mom? A senior service website that is designed to help folks find services for their loved ones who need to go to an extended level of care. This is essentially a place to start for the community. The database for our providers, that my Connect, or my Resource Connect, the one thing that I've noticed as I've gone to Open Door, as I've visited with United Way and the COC, the Continuum of Care, it's hard for people, caseworkers, to work together because the systems aren't there. And in this day and age, 2022, we should have technology there for these providers. And I hope that we'll talk about this reentry specialist, which perhaps we could talk about a rename of that. It sounds like we're going back into the jail. So maybe a begin again program specialist. But these are essential. At the end of the day, we have to pay these people what they're worth. And we have to pay these people to stay. Because what happens, and I see Sally in the back, our housing programs are very difficult. We have our Housing First program, we have Shelter Plus Care, we have our Emergency Solutions Grant. These are complicated programs to understand. So what happens when someone talked about caseworkers and folks who get into this, it takes them, what, like 6 months or so, like a year to really understand the programs, and by then they're burnt out because they're dealing with getting punched and kicked, and so by then they're done. And so then when we hire someone new, it takes them just as long to figure out the program, and it's difficult. And so paying people to stay in this field is essential. I appreciate the conversation today, and this has been a lot of work coming through. And one last thing, I'd like to include a diversion hub. When we have somebody to work with like we have a reentry specialist, we need somebody to help navigate our court system. I'm trying to do that with my dad right now, and it's very difficult. And so imagine someone with mental health issues, very acute. How are they going to handle this mental health crisis and being picked up? If you're a homeless person, you get picked up because you're trespassing, because you try to find a place to sleep. Just yesterday, KMUW reported that 5 homeless people died because of the extreme cold. And one of those guys was sleeping on the sidewalk behind my house. So it's a difficult thing, and I'm so glad that we're having this conversation. I appreciate your attention to this.
Councilmember Ballard.
Thank you.
It's not Mike Brockett.
I just have one question and a comment. My comment is I appreciate all of the attention to workforce. I love the idea of, some type of new campus, wherever that ends up being, but if we have a brand new building and we don't have enough people to work in it, then it doesn't really work. So I appreciate all of the extra effort in trying to think of new ways to encourage people to come into this public service, just because it is, like Lacey said, I don't even think we've seen the tip of the iceberg, especially in children. And I know that ComCare is lacking, and all of the areas are lacking in workforce, so I appreciate that. And my question is, hospitals struggle to help folks in crisis stabilize because of involuntary holds are only 72 hours. Other states have updated their laws to allow 2-week holds, so care providers have time to stabilize people on their meds and help them get services. Has there been any discussion with our state partners about updating these laws to reflect more modern practices?
The quick answer to that is no, ma'am. There has not been anything that I'm aware of that's been proposed in a change in that state statute.
Do you think, with your professional opinion, that that's going to be helpful?
In the hospital, when we have someone who's there on an involuntary hold, in that first 3 days, we work very hard to try to stabilize them. During those days, we can give medications involuntarily. And so we work very hard to stabilize them so that, and have constant conversation to help them realize this is where they need to be. But I agree with Sheriff Easter. I have not been a part of or heard of any conversations to change that.
And would you recommend that somebody starts those conversations, or?
I need to think about that.
Okay.
Because I'm not sure.
Okay, thank you.
Further comments on this? Councilmember Hoheisel.
Yeah, just real quick here. On page 27 of the report, it talks about the subcommittee some of the subcommittees should be expanded to include other visions, businesses, representation of downtown Wichita. I'd just like to make a note that I think South Wichita needs to be included in these subcommittees and these discussions as well. We're facing a different kind of issue than downtown Wichita because people are not south of Wichita for services. We have hardly any services down there. They're down there for device, they're down there to get a device, they're down there for sex trafficking and so many other issues. And I'm sure all my colleagues south of Kellogg here can agree that it's just a whole different animal down south than it is in the core of the city. So just make a note of that. Thank you.
Just a follow-up to Councilmember Hoheisel, when it comes to adding more service providers, I am somewhat disappointed that we weren't able to incorporate some of the domestic violence services. The last discussion we had, I thought that the folks who worked in this field agreed that domestic violence is a variable that leads people to homelessness. And so I'm hoping that as we move forward, if there is a way to synthesize services so that we can get the most out of them, that would include domestic violence, we look towards that. If there was not, then there was not. But if there is, it seems from my research that there are some services that could cover issues that domestic violence victims face as well. Last thing I'll just leave on is KSA, or Kansas Statute 194603, is what describes how a county can institute a hospital. My assistant just shot me a text saying that there is actual legislation on the books on how to create a county hospital, so I did want to report back to that in case folks are interested. That's 19-46-03. Is there further conversation? It looks like we have Councilmember Blubach.
Thank you. I want to jump on board here with my fellow Southsiders, and I talked to the Sheriff about this a little bit before, and I talked to the City Manager about this in WPD. I've asked for some heat maps of the entire city so that we can, one, see exactly where mental health calls are, and I asked for a second map showing when there's violence, when there's been a knife stabbing, someone hit or something like that, just so we have a better idea at a glance where the more concentrated areas are, and then hopefully we can match up resources from those areas.
Thank you. I'm really excited to hear about the My Resource Connection database that Johnson County is using. I do have a couple of questions around that. Like, is there a fee for a nonprofit to join that? Is that in the $20,000 a year flat fee that's being requested from the city and county, or can you just go into a little bit more detail about the database?
Absolutely, and I will tell you that our service providers are very excited about it as well. If you've got any friends up in Johnson County right now, you might want to give them a call because they're actually going to review our application tomorrow.
Okay.
So we're hoping, and I do want to mention Sedgwick County we've actually had to apply to become a part of this because it's going to be a burden on them. Sedgwick County has really stepped up in that and allowing their IT department to assist on that project, so thank you. And maybe even improve upon it, getting like a mobile app for providers as well. So thank you for Sedgwick County. As far as costs go, we have received some donations. One of them was from the Kansas Health Foundation for $50,000 that would cover probably the first 2, maybe 2.5 years of that. Our goal as a coalition is to make that available to service providers for free on an ongoing basis. It's something that the community needs, wants, and I think that there's money out there for that. So that's really exciting.
Yeah, that's the one thing that really kind of caught my attention in a lot of this was just how can we utilize technology going forward, because that's the way we're heading anyway, so how can we get on board with that right now? I do have there are some asks in here that are reoccurring, and I see ARPA as being looked at a lot of these things, and I think ARPA is a great opportunity to use for one-time asks, but I'm very concerned with anything reoccurring that would come, just because that would end up having to come out of our general fund, and how would we even make that happen with the limitations that we already are under today. So that's one concern, but I am very excited to look at how we can utilize ARPA and some of these immediate need, big projects and one-time asks. I think a lot of what I wanted to say has kind of already been said, but I agree that with Commissioner Howell, like this is going to be all about the money, right? So we have to make sure we're doing everything we can to be as collaborative with our government, our private sector, our nonprofits. I mean, everybody needs to be on the same page. So I love the idea that Chairman Dennis brought up for an RFI, just so we can look at really what does the community as a whole want, present this and see is there anything additional that they would like to add or placements. I just don't want to limit anything to necessarily it has to be this or it has to be that. So I really look at this as a living document, and I think you guys have done some incredible work, and I'm really excited to go forward with that. And so hopefully we can get that process going as quickly as possible, and we can keep down the path that we're on and utilize a lot of these, like I said, the ARPA funds with the state and everything else. So thank you guys so much for all the work that you do. I really appreciate it.
Absolutely. I will kind of follow up on that. We have had some conversations with the private sector as well, because they're a part of this. And I think that there is absolutely some backing on that. So I don't think it's going to fall all on government to do. So as a community, we need to, it might be money, it might be time, volunteer time, right? Might be donations, it might be, just good vibes to get this done. So as a community, that's what we need to do. I do want to address something that you talked about, Councilwoman Ballard, specifically about the resource center, the access center inside the hub. And staffing. This would be a place, kind of a co-working place, where providers that are already in existence would send people for different varying amounts of time. Now, what does that look like? It could be 4 hours for one provider. It could be 24/7 for some providers. So it would be a place where current providers in our community could actually come and provide those services, those warm handoffs, instead of 10 blocks away or 10 miles away. It's just right across the hallway. So that's one good thing. And I will tell you that we did kind of a preliminary survey with service providers about who would want to be involved in that, and I literally got 0, no, we don't want to be involved with that. It's what's the cost, right? And then how much would you need us there? There's licensing issues, because if you go to a different facility in some situations, those are questions like that. But it was more of how can we be involved as opposed to, no, we don't want to be involved in that. So that's exciting. That's exciting. And I think as far as the hub and the campus, you know, there's a lot of information there. I have interviewed a lot of people from across the U.S. that have built these. And, you know, they were like, oh, we did so many things right, but, oh, I wish we would have done this, we would have done that. This is outside of my purview of planning, right? This is city planning, this is architecture, this is studying what worked and what didn't work in other cities, and then what can work here, and coming up with that plan. So I think that that's going to be important to do moving forward.
I think my biggest concern was just making sure that we're able to give good quality of care, and so that we have enough staff members to, you know, not have 200 caseload or whatever it is. Just making sure that we have enough providers that are willing to provide so that we can give quality of care so that we're moving the needle and not saying once a month or whatever.
Absolutely, and that's the beautiful part about that resource center, because instead of trying to make phone calls and trying to figure out who to call and what agency to go to, and, you know, maybe getting a hold of them or maybe not, being able to walk them across the hallway and introduce them to somebody that they already know as a service provider. So that's going to save time for those service providers. And they can do dual, you know, they can do intakes together. So they're not sitting there going through forms after forms with people and repeating that same thing. So that's going to be the exciting part of that center.
Thank you. Commissioner Howell has some comments, and then if no one else has anything, I'd like to make a couple of summary comments after Commissioner Howell.
Thank you, Mr. Chairman. Just to the point that two council members have talked about already regarding the south side, I agree with those comments. And Commissioner Chairman, you made a comment earlier about we need to move this to a more transparent process. I think that is really necessary. This coalition has met for years behind closed doors, and I've never had the chance to participate other than we've had 2 or 3 public meetings during that time, and I participated in those. I appreciate the chance to have that opportunity at those times, but for the most part, this coalition has met among themselves behind closed doors, and it's not that I don't care. I care deeply, but I have never had the opportunity, and it's almost unfair. You are wanting us to buy into the solutions that are coming forward. You want us to put our weight behind revenue or whatever it's going to take to make these things move forward. I completely agree. It's time for us to do something. But I think this needs to move to a transparent, open process so that you can get buy-in, not just from elected officials, but from the community itself. You know, I see that there's news cameras here today, and I appreciate them very much. By moving this to an open, transparent process, the community then begins to understand what people on the coalition understand and what other elected officials will begin to understand. So I know the coalition is not government created, it's private sector created, so to speak. But I think it needs to move to an open meeting, and it needs to be subject to Open Meetings Act. And we need to get other elected officials at the table so they can understand what's going on and they can participate and they can add input. And I think that the media and the community itself would like to participate as well. So I would urge a change in direction. We've done this for years behind closed doors. It's time to move it to a public open thing. And to the point that the council members made, we can get some South Side input and we can make sure that we have South Side representation, South Side perspective involved in this, as I think as it should be. So I have a strong opinion about that. I hope that we would move this to an open process. Thank you, Chairman.
Thank you. Do any council members or county commission have anything else that they'd like to say? I've got a couple comments that I'd like to end up with. Mayor?
Just to follow up on a commissioner's comments, is there someone that we could reach out to if we wanted to get more in depth with some of this information, instead of calling everyone on the coalition, of course? Like, who would it be? Sheriff Easter? Who should we reach out to if we did want to get, as electeds, caught up on some of the information and discussion with these items, if we weren't able to attend any of the past meetings? Would it be Misty, maybe Sheriff Easter?
For as complex as the report is, especially with what was asked of the coalition 60 days ago or 90 days ago, it would be Misty at this point.
Well, just a couple concluding comments. First of all, I want to thank the sheriff. I've been working with him for a number of years, and I appreciate exactly what he's doing on this. Misty, I appreciate the support of you and WSU as we move forward. Robin, you've been a great person to work with ever since I met you 5 or 6 years ago now, so thank you very much for what you do. And Brenda, thank you very much. You asked us to do a couple things because you ended up your slides with an ask, okay? Now, I just talked to the mayor a little bit ago, so we're not going to have a vote today. So we need to bring it back to the county commission and the city council. Did you have something you want to say?
Yeah, let me. And perhaps I need clarification from legal. Our ordinance is specific for en bancs, and I believe we have to have a normal council meeting to take binding action, and that was the preface of our comment. And legal, is that correct?
That's correct, Mayor.
Thank you.
Well, with that said, I want to make sure that we don't walk out of here and say that we received and filed this and then forget the efforts that went into everything that went on. I do have a couple requests that the City Council take a look at the asks that are on the back page of this briefing. I'm going to ask our manager to bring this back forward to us at a future commission meeting so that we can work on it. I do have one question. Do we need a formal vote to put out an RFI, or can we just start the RFI process?
I'll take a stab. I think if both electeds are going to go back to their benches, respective benches, and talk about this, I think it should be probably voted on at that time, and then we can move forward immediately.
Very good. Well, so today I'll make a motion to receive and file for the county commission. Do I have a second? We have a motion and a second. Any discussion? Seeing none, Madam Clerk, call roll.
Commissioner Meitzner.
Aye.
Commissioner Cruz.
Aye.
Commissioner Howell.
Aye.
Commissioner Lopez. Aye. Chairman Diggs.
Aye. Well, again, I don't want this to be the end. I heard, you just heard that we voted to receive and file, but we'll bring this back as an agenda item before the county commission so that we can discuss it and we can make some decisions to move forward. So again, thanks for the coalition. Thanks for each of the briefers today. I don't have anything further. Mr. Mayor, do you have anything further? For as far as the county commission, then we're adjourned. Thanks to everyone for attending today.
And if there is no objection, then the city council, we shall be adjourned as well. See no objection, we're adjourned. Thank you.